contributing to a accelerated decline in kidney disease?
Really cause a lot of damage there, especially long term. Many Australians, they have reflux, gastric esophageal reflux.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements formulated to support those diagnosed with chronic kidney disease live a better, fuller, healthier life. I am so excited today to be running this podcast with a new guest to our show. Therese is an amazing Australian. She's a consultant pharmacist. I met her by being a participant on her podcast a few weeks ago. So Therese is a consultant pharmacist, as I mentioned. She's a health strategist, and she's a wellness researcher. She specializes in bridging the gap between traditional medicine and functional health strategies. She's got an absolute keen focus on chronic conditions like kidney disease, metabolic syndrome, high blood pressure, all the things that we know contribute to a decline in kidney function. As a pharmacist, what medications do you see time and time again contribute to the decline in kidney health, or could be a contributing factor? Because I think people out there, lithium is obviously one we see all the time, long-term lithium use for bipolar, just destroying the kidneys. But are there other more silent ones or medications that you see routinely and you think, this may be contributing to a accelerated decline in kidney disease?
100%. The list is expanding, and we know the common ones, like your anti-inflammatories, your pain medicines, they really make a dent on your kidneys. They really cause a lot of damage there, especially long term. We know as well, the blood pressure pills, so ACE inhibitors, and one that might just miss the radar is your proton pump inhibitors. So many Australians, they have reflux, gastric esophageal reflux disease, and they might be on a proton pump inhibitor to reduce the acid, but in fact, you can get acute interstitial nephritis from there. So again, it's about increasing the index of suspicion, looking at how they're actually sleeping, how many times they wake up to pee, whether they have fluid retention. So diuretics as well, it's sort of like a double-edged sword. You use it to actually help, reduce the fluid, but in fact, it can actually cause problems with electrolyte balance, and anything that does, impaired balance can affect the kidneys as well. And then the new diabetes medications, the one I mentioned was the SGLT2 inhibitor. So the brand name would be something like Jardiance, where it helps the patient pee sugar. However, it can actually cause problems with the kidneys as well. And as the renal function declines, we need to match up the doses of the medications. And a lot of times we use EGFR, which is a automatic calculation that the labs put together. But a lot of times the medication, their dose recommendations is based on creatinine clearance, and that requires a bit more thought in that. So a pharmacist might have a look at their height, their weight, and their ages and their creatinine levels, and do a calculation to get an estimate. They're not 100%, but it gives you an indication as to we need to actually drop the dose because the dose makes the poison. So it really is about looking at the person holistically and making sure, for the signs and symptoms that might alert us that something's not 100%, and making sure the medications are at the right doses, and making sure the ones that's causing lots of damage, it's going to be minimized. You're trying to, again, reduce it. And more importantly, if we actually look at the root cause of the problem. So, for example, with proton pump inhibitors, a lot of times I'm finding that, it's spicy foods or, acidic foods that might trigger it, coffee, spicy foods, or even the position of their bed. So when I ask them, what normally triggers your reflux, and then they tell me, and if it's easily fixed, you could just use your proton pump inhibitors when necessary. It takes about 15-30 minutes for it to kick in, or even better, you can reduce those foods that might be causing indigestion, or you might raise your bed head by 20 centimeters so that the whole positioning is just right as well. And stress is massive, isn't it? Because that gut feel, etc. So a lot of times I might ask, what triggers it? And stress, it also comes up as the one of the answers. It's about having routine to help regulate stress that's sustainable to the patient, whether it's deep breathing, whether it's chewing their food mindfully, and making sure everything is sort of at rest, and reactivating the rest and digest system instead of our flight and flight, our sympathetic nervous system. So that is a really good example of one where in my reports, I always have a look at their reflux, their stress, and give the doctors a bit of a background as to why they might be having those symptoms. And perhaps with the proton pump inhibitors, they might not be as benign in terms of how the consequence, because you do need acid to break down foods and to actually absorb nutrients, whether it's iron, calcium, magnesium, etc. And also you really need to again ensure, like, with all these medications, that there is a risk-benefit analysis, that we're not on something forever. I've had patients that's been on proton pump inhibitors for 30 years that might not actually require it. So I think, really be checking with the patients on a regular basis. Do they really need this medication is also a tip that I would recommend.
If anyone has any specific questions for Therese, please put them in the comments below and I'll be sure to reach out to her. For everyone listening, make sure you hit like and subscribe. That way you'll get notified anytime we put up new content. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on all socials under the same platform. Therese, thank you so much again. If you want to reach out to Therese, she is in Australia. I'll put all her details in below. And again, anytime you want her to come back and talk about a different medication, please add a comment and I will be sure to get her back online. Therese, thank you so much for being part of it. I appreciate you and I look forward to seeing everybody next time. Bye.